So hi everyone, my name's Erin Gleason. I work for the Northwest Colorado Visiting Nurse Association. In addition to being a federally qualified health clinic, we're also helping people figure out how to enroll for Connect for Health Colorado. So we are a resource for the community, and feel free to contact us with questions or any specifics about your case. So why do we care about uninsurance in our county? It turns out that Routt County has a higher rate of uninsurance than the rest of the state and actually the national average. We care about this because when someone is skiing on the slopes and they're uninsured and they break their leg, they go into the hospital and get these huge bills that they really don't have any hope of paying back. So the hospital is really great with working with people trying to get their bills down, but for the most part, they swallow a lot of those costs and then turn it around to us in the form of higher prices because they have no choice. So we really need to be concerned. It is a local issue and it affects our local economy and how much we are paying for healthcare. So one of the ways that we're trying to get people more insurance is to make it more accessible. And part of the way that this is going to happen is through Connect for Health Colorado. So as you know, the federal system, healthcare.gov, is running, unless you are totally out of it. You probably have heard about this in the last few months. So luckily, Colorado created their own. It's called Connect for Health, and it is working much better than the federal system. So if any technical problems are kind of turning you away, please do not be afraid of that because we can help you through it. So Connect for Health Colorado is great because it's going to be the only place where you determine whether or not you're eligible for a tax credit. So even the brokers who are working with clients who are eligible have to be certified and they have to use the same site. You're not supposed to go to healthcare.gov. As a Colorado resident, you're going to Connect for Health Colorado. We also have an assistance network, so we have a lot of support in the community at the VNA, at the hospital, Yampa Valley Medical Center, and at the Routt County Department of Human Services who are helping you go through these applications. So it's important to know that everyone can go online and look for coverage in Connect for Health Colorado. The only kind of qualifications come when you're looking at receiving a tax credit. So you won't qualify for a tax credit if you're already offered insurance through your job or through your spouse's job. So taking the VNA, for example, we have really great insurance for ourselves, but when we add on our dependents, the cost of that premium grows pretty quickly. Unfortunately, we are not eligible for a tax credit simply because that is offered to us. So this is something called the family glitch, and I really encourage everyone to talk to their state representatives about this. It's a piece of federal legislation that I think we can change, and it would really benefit a lot more people in the community. You also don't qualify for Connect for Health Colorado if you qualify for Medicare, so it's not for supplemental Medicare plans. I do have information on someone you can contact if that's your situation. If you have to file your taxes jointly with your spouse, otherwise you won't qualify for the tax credit. And you have to be in a certain income range. So I'll get more into what that income actually looks like in a second. So what are they looking at for income? They're looking at a new measurement called your modified adjusted gross income. So this is what the Connect for Health Colorado website says. I think the most important I've underlined and put in red. So mainly, wages, salaries, tips, alimony received, capital gains, those things. So we're looking ahead. We're looking to 2014 because the tax credit that you get will be based on your predicted income. So for a lot of people in town, that is not a very easy number to come up with because we work a lot of seasonal jobs. If you need help estimating your income, you should definitely try and talk to your tax accountant. They can help you with that. And then also at the VNA, we have some tools and resources you can use to help you estimate a number. So the income ranges are between these two numbers, and it is a sliding scale based on the size of your family and your income. So if you're not a family of 1, 2, or 4, the numbers will change a little bit. So if you are, does this have a lighter? Yeah, cool. So if your income falls below this number, which is on the left-hand side, you now qualify for a program called Medicaid. And if you're above income over here, you do not qualify for a tax credit. So the federal law is written that people between this income and this income receive subsidies. People outside of that gap are not eligible. So the way that it works is the tax credit, you get it in advance every month and you apply it to your premium. So essentially when the insurance carrier goes into, you pick a plan, the carrier has a contract with you and they also have a contract with the government. And the government will pay a certain amount and you will end up paying a certain amount each month. Another form of savings will come through cost sharing reductions. So a lot of families in our community qualify for this public health program called CHP Plus. So this is for families in that income range, and I listed it out here for you as well. And you're going to get a low-cost children's health insurance through the state program called CHP Plus, and also reduced copays and deductibles for those people. So it's all based on your income. If you see like midway through June, you say, oh man, I got those big contracts last December, or I got a contract coming up. I know that my income is going to be above what I reported. You need to go back into Connect for Health Colorado and report those changes so that they can adjust how much of a tax credit you will be getting. Because you will have to pay back whatever assistance you receive if your income is actually higher than what you had claimed. So we are telling people, go with a higher estimate for your income. That way, at the end of the year, you would probably get more back in a tax refund than you would have to pay back to the government. So I'm thinking of changing the top header of this slide. No, I'm just kidding. So the application process is a little tricky and it's kind of confusing for people who are coming in off the street and trying to figure it out on their own. Luckily, we have worked with a lot of the insurance brokers over here and all these different agencies in the community to try and get the word out about how to apply. So fortunately, I met with someone last night and she said, I just want to stay with Rocky because they have all of my health information. And I said, you don't need that anymore because they can no longer deny you or charge you a different rate for having a pre-existing condition. So you don't have to include information about your medical history, but you do need to provide information about your income, about your age, your family members, where you live, things like that. The last three are going to determine how much of a subsidy you get. So living in Routt County, we do have higher premiums, but we're also getting a larger tax credit to offset that. So essentially, there are two applications. You can go either way. You can start here and go to Connect for Health, or you can start Connect for Health, and it'll pop you over here. And this is called the PEAK system. It's the online application for Medicaid. So it's a federal requirement that you have a denial from Medicaid before you're able to continue and get the tax credit. So if you don't qualify for a tax credit or you don't want a tax credit, you don't have to go through this long process. The process becomes a little bit more difficult when you are eligible and you want to get that subsidy. So PEAK, is the online application for Medicaid. You go in there, you fill it out. It should pop up a number to you right away that you then just take this 1B case number and put it into Connect for Health. And the two systems are talking to each other saying, yes, they've already applied for Medicaid. They don't qualify, but they will qualify for a tax credit. So this tends to be the problem. People are getting confused and their applications can get stuck. So if you have any problems with this part of the application, feel free to contact us at the VNA or Yampa Valley Medical Center or the Department of Human Services. So insurance is going to look a little different from now on. It's going to look a lot more like an employer-sponsored insurance plan. You'll have open enrollment periods. This year, it goes all the way until March 31st. If you sign up for insurance, even on the 30th of March, you will not have to pay any penalties. So that's extended for everyone during the whole open enrollment period this year. So you have all the way until March 31st to kind of figure this out and get it all together before you get fined. Careful, because if you purchase insurance before the 15th, it'll be active the next month, but after the 15th, it will be effective the following. So that means if I need coverage by February 1st, my application has to be done by January 15th. So that's a heads up for all of you to kind of plan ahead. There are special enrollment periods. So if you have something that happens and you need to change your insurance, it's not like you buy a plan and you're completely stuck with that plan until the next open enrollment period. You do have an opportunity to go in, tell the system like, I had a baby, or I got married, or I lost my job, and it would reevaluate your tax credit based on your new household income. Because if you add a kid, or if you subtract a husband or whatever, your tax credit is going to be a lot different than if you just kept it the same for the whole year, and that's when you would run into some problems. One of the biggest changes in insurance is that it will start covering a lot more things. So these are the 10 essential benefits, we call them, and these have to be covered by every single insurance plan that's in Connect for Health Colorado. So there are 10 inside the marketplace, and I'm going to venture outside the marketplace and say that only 6 of the 10 have to be covered in plans that are sold outside of the marketplace as of this year. So all of these benefits have to be covered. Preventive care services are now free. So for like annual exams for women, colonoscopies, flu shots, things like that, those should all be free now. Of course, there is never such thing as free. Sometimes with medical things, you have other tests they have to run or things like that. So just check with your insurance company before you go and see a doctor. But those things should be free, which means no copay associated either. Because all of the plans cover kind of the same benefits, now what you're choosing is how much you're going to pay out of pocket. So there are 4 different tiers, and then there's also this CYA, which is the catastrophic plan. That's only going to be for kids under 30. So if you're above 30, you're no longer eligible for a catastrophic health insurance plan. So for people who are young, they don't have a lot of health issues, I tell them go with a bronze package. You'll end up, spending the least amount on premiums every month, but you probably won't use your insurance all that much, so it won't matter to you. I've had other people who say, I can't wait for this to come about. I've been waiting to get on insurance. I've been waiting to have procedures done. I say that they probably need to look at a gold or a platinum plan, because if they're expecting a lot of healthcare expenditures in the next year, they should really try to minimize how much they spend out of pocket. But it's cool because in the next open enrollment period, if they get all their surgeries done and they're healthy, they can go back in and change to a different plan that's a lower monthly premium. So every year at open enrollment, you have the option to change your insurance or change your policy. So just one last thing I want to touch on will be the expansion of Medicaid. So Medicaid is a health insurance, it's a free state health insurance program for low income. It used to be, and Linda will talk about this, Colorado has been really pushing forward with this initiative because a lot of those people in this income range tend to use a lot of the really expensive health care that we have, like emergency services and things like that. So the last piece is getting those people making $16,000 and less on Medicaid. So if you go through the Connect for Health Colorado program, it will automatically show you what things you're eligible for. And when you go in and you elect to do it, you will be put in that program. So if you qualify for Medicaid, even if you would prefer private insurance, you're not eligible for a tax credit because you are eligible for Medicaid. So this is kind of what it looks like. We have Medicaid expansion going on here. This is the 3 different groups that we look at usually in public health. So children, pregnant women, and adults have different qualifications for what they qualify for in terms of state programs. So adults used to kind of not have any assistance. This whole column used to be blank. Now we have an expansion of Medicaid. So most of these new Medicaid people are adults without dependent children. Then you get a premium subsidy and cost sharing reduction. So that means you get lower copays and deductibles. And then up here on the top would be the premium subsidies again. So what are we doing locally to help you with these applications? We have a few open enrollment sessions coming up, and Yampa Valley Medical has been so crucial for us, giving us a spot and a lot of assistance with a lot of their staff. And we will sit down with you if you bring in your laptop and go through the application with you right then and there. We also have participating brokers who are available to help you go ahead and purchase an insurance policy. So for some people, they can come in, do all of the application, meet with a broker, and have health insurance within like an hour and a half. So it is a really valuable tool. We'll at least give you a good start on where to go from there. So I really recommend you come to either one of those sessions. And we'll continue these into January as well. So keep your eye out in the newspaper. We're always advertising them there. I also go to the Bud Warner Memorial Library on Fridays and Lift Up on Mondays. The times sometimes vary, so just check in the happening section, and I would be more than happy to sit down with you and talk you through kind of what you're eligible for and where to go from there. We also have help by appointment. I can say that, the new deadline is now December 23rd for you to purchase insurance that starts on January 1st, and our offices are booked. So most of the time we would be able to, and right now I think we can schedule something at the start of the new year. But really for you guys, I think the best resources if you're trying to get insurance by January 1 would be these top two sessions. So that's where I got my information. The top three are links for Connect for Health Colorado, and then healthcare.gov, the Small Business Association, and Kaiser Foundation. And here's my information. So feel free to call me or email me. Email is usually a really good way to contact me. And if you have individual case questions, if anyone is confused on the status of their application, please do not suffer in silence and reach out to us, because we can help you. We have the resources and we know kind of what the process is. So please get in touch with us if you need any help. And yeah, I just wanted to definitely say thanks to Yampa Valley Medical Center and Wells Fargo for having us today, because this is a really great way for us to come together as a community and try and figure out what can be a very complicated and kind of daunting process. So thanks a lot to you guys, and thanks to everyone. Are you good?
I got very specific instructions on how I was supposed to put this on, so I wanted to make sure that was right before we got started. But thank you all for coming today. My name is Bill Crosby. I am with Steamboat Select Insurance Group, which was formerly Brown & Brown Insurance. We are now locally owned and operated, and I know that's important to a lot of folks that are here today. And today, Aaron reviewed the individual options, and thank you, Aaron, that was great. I'm going to be reviewing options for your business. And as a broad outline of what we'll discuss today, key points, we're going to discuss key points and decisions that you'll need to make to find the right plan for healthcare strategies for your business. So we're going to discuss your business demographics, the trade-offs for different plan choices, tax credits and financing strategies, and the availability of these plans both on and off the exchange. And we're going to finish with some examples of choices I've seen my clients make, and you can draw some parallels to your business through that process. So let's get started. The Patient Protection and Affordable Care Act has several goals, the top of which is to reduce cost and increase access to health care. Now, how does this impact businesses? In a nutshell, if you employ more than 50 full-time, year-round employees, you're required to offer coverage. And this does affect large businesses. But I'm curious, by show of hands, how many folks in this room moved to Steamboat specifically to work for an employer that had more than 50 employees? Okay. So just a few folks, and that's what I thought. A lot of folks moved to Steamboat for other reasons, and I know that I did as well. So today, because of that, I'm going to focus on small businesses or those businesses with less than 50 employees on a year-round, full-time basis. So what does the Affordable Care Act say for small businesses? First, it says that you are not required to offer group coverage. Let me repeat that again. The law does not require you to offer group coverage for your employees. However, we find that many businesses choose to do so regardless. And as an advisor, this is how I begin to assess the options for my clients. First, I look at a business's demographics. How many employees do you have? If you have 1 to 24 employees, you may qualify for a small business tax credit. Similarly, what's your average pay? If your average pay is under $50,000 a year, which excludes owner pay, then you also may qualify for a small business tax credit. And finally, and most importantly, I think, what are the margins of your business? Does your business consistently earn revenues to support group plans? Maybe it's a better option to offer individual plans to your employees, especially if your industry is particularly volatile from year to year. Secondly, what are the trade-offs between your plan choices? Individual plans have some tax consequences that you should be aware of. First of all, employers, they can contribute additional funds to their employees to help with costs, but be advised that employees and employers pay additional Social Security and income taxes, neither of which is optimal when compared to a group plan. So a group plan, group employees can choose to pay their premiums pre-tax. And this can make a really big difference. Let's take an example of a family. Say their premium for coverage is $800. If they pay on a pre-tax basis, every month $800 is taken out of their pay before they pay taxes. However, if they're in the 25% tax bracket, if they choose to pay after tax, they need to take home $1,000 of pay to pay that same $800 bill. That's $200 a month. That's $2,400 a year. That's a big difference, and it adds up quickly. And finally, and also on this point, for group plans, businesses can take the contributions they make towards their employees' plans as a tax-deductible expense. And that can also be a big deal for employers. So the last option is the Shop Exchange. And this is the marketplace for employers through Connect for Health Colorado, where they can choose multiple group plans. And there are some big advantages here. Employers can use this option to potentially qualify for the small business tax credit. And we're going to discuss this here shortly. But what I think the biggest advantage of the Shop Exchange is that employers can offer more than one plan design for their group. For instance, Aaron spoke about the bronze, silver, gold, and platinum plan levels. You can choose any 2 connected tiers for your group. For instance, bronze and silver plans, or silver and gold plans. That way, if your employees want to choose different different plan options, they have the flexibility to do so. It's pretty cool. So with these factors in mind, let's discuss tax credits and alternative strategies. First of all, I've talked a little bit about the small business tax credit. And this can subsidize up to, let me repeat, up to 50% of the employer's cost for offering a group plan. To qualify, you must have less than 25 employees or less, and your employees can make up to $50,000 in average wages. Again, that excludes you as the employer and your wages. And it is a tiered system. So, for example, a group of 3 employees that has an average $20,000 wage would probably receive the full 50%. Whereas, if your business has 24 employees and your average wage is about $45,000, you're probably not going to qualify for nearly as much. And the small business tax credit is only available for groups who buy plans through the Connect for Health Colorado Shop Marketplace. Now, if a group plan isn't sustainable, which it might not be, or if the pay for employees qualifies them for financial assistance, then you as a business could have your employees buy their plans individually from Connect for Health Colorado and take advantage of the advanced premium tax credit. Like the small business tax credit, the advanced premium tax credit is tiered. So for a 30-year-old that makes $25,000 a year, their subsidy is going to be much lower than a 50-year-old who makes $25,000 a year. But there's some logic to this, because a 50-year-old's policy is going to be much more expensive than a 30-year-old's policy. Now, there are other financing strategies that are available, including alternative funding arrangements. And we're not going to get into the details of these today because we can spend an entire afternoon discussing the options. But in a nutshell, there are creative and cost-effective plans available, but only in the private market. And if your business employs more than 10 full-time year-round employees, you should seriously consider those options with your broker. So the big question is, where can we buy this coverage? For your group, you can buy this coverage either on the exchange or off the exchange. If it's on the exchange, you're going to go through the Connect for Health Colorado marketplace, and you can do that by yourself, or you can use a broker. Off the exchange, in the private market, you can work through your broker, and you can access plans which are not available on the Connect for Health Colorado website. Now, importantly, and I want to point this out, there isn't any additional cost to work with a broker in either scenario. And why? We as brokers are compensated by carriers for health insurance just like we are for workers' comp. So we're a resource for you. This is a very complex topic, and so take advantage of us and use us as resources for your businesses and for yourselves. Our experience can guide your business. So with that in mind, let's look at some examples of what that experience has shown us. So here are 4 employers that we work with, and I've changed the names to protect their privacy. And if there's anybody from the IRS here, I don't own these 4 businesses. Don't come looking for me. But the first is Bill's Designs. So Bill's Designs has 4 employees, and these employees have spouses and children. Their average salary is $55,000 and up. And their decision was, their employees, they make too much money to qualify for either the advanced premium tax credit or the small business tax credit. And since individual and group plans are very similar cost, this group decided to go with an off-exchange group plan because they could utilize their pre-tax contributions and because more robust network options are available outside of the exchange. This made the off-exchange plan the best for their group. Now, we've got Bill's Ski Shop, and they have 8 employees, aged 22 to 45. Most of them are single, average wage of about $32,000. You know, we don't know what the winter's going to bring, and a lot of times we might not have the best winter, so it's hard to predict what we're going to be able to sustain cost-wise every year. So while we'd like to contribute funds for employees when possible, we can't really say we want to have a group plan that's going to be ongoing. However, at $32,000 a year, most of the employees qualify for an advanced premium tax credit. So Bill's Ski Shop, they decided that going on the exchange and purchasing individual plans was best for their group. Now take a look at Bill's Auto Repair, the same number of employees making the same amount of pay. However, these employees have spouses and children, and their spouses earn higher income. So the combined family income disqualifies the employees from the advanced premium tax credit. And also, the employees in this group, they requested multiple plan options to fit their family circumstances, not one size fit all for this group. So with the small business tax credit, Bill's Auto Repair was able to sustain the group plan cost into the future, and therefore they went with the shop marketplace through Connect for Health Colorado. And finally, Bill's Tax Service. Usually has 18 or more advisors on staff making an average of $45,000 and up. And what they found was that their wages and their number of employees made financial assistance from the small business tax credit minimal at best. But their group size, their employee demographics, and their business margins created the opportunity to work with their plan in the private market. And they were able to achieve plan design flexibility. They lowered their total cost to their employees, and they were able to offer additional benefits to themselves as the employer through working with an off-exchange, alternatively funded plan. So one thing we didn't discuss today was what the options are for businesses that have 50 or more employees. That's a much more complex topic, and we should discuss that after this meeting. All right, thank you all very much.
My name's Linda Gann. I am from Montrose. I'm the Western Slope Outreach Coordinator for Connect for Health Colorado. My father-in-law, L.B. Gann, used to be president of Colorado Mountain College back in the 70s, so it's kind of fun to be back here. It didn't look like this then. I'm going to kind of give you a why are we going through all of this, because I think that's important to bring context to problem solving. And we had a problem, and we are beginning to solve it, and I think that's an important thing to take away. Both Aaron and Bill did a fabulous job talking about the nuts and bolts, and you guys are lucky in this community to have such a resource. I've traveled around the Western Slope, and the collegial relationship between health coverage guides and brokers does not exist in every community. So it's awesome, because this is a big deal, and buying health insurance is complicated. And what I'm going to do is give you a little bit of history about why we're going through it, talk about what I call Colorado's plan. Aaron and Bill did a great job outlining the Connect for Health individual market and small business market. And then I'm going to give you some stats on how we're doing. So, a little bit of history. Back in 1942, Congress put a wage and price freeze on their employees. Large companies could not give their employees wages. It's World War II, everything's raging. So what happened is employers could began to offer health insurance, or began to offer benefits, because that was not under the wage and price controls. So we know that this policy had a big impact on the number of people with health insurance, because in 1940, 1.3 million Americans had health insurance. In 1945, 32 million. So a huge difference. And this is one of the things that separates the United States from other industrialized nations. They don't have employer-based health insurance like we do. Then in 1954, something happened that Congress codified the income tax code. And you've heard a lot about tax credits and for the small business, tax credit for the individual. And I think the reason that we're hearing about that is because for the last 60 years, the large employer has not had to pay payroll tax on the value of that health insurance that they've been offering their employees. The employee did not have to pay income tax on the value of that health insurance that they were getting. So for 60 years, if you were a large employer or happened to work for a large employer, you've been receiving a pretty nice little tax advantage. 60 years. And the value of that tax is, in 2012 alone, was $260 billion. So in other words, if that tax code did not exist, the US Treasury would have captured $260 billion more dollars in 2012 alone. So it's a significant tax advantage that the large guys have had for 60 years. And I think that's important to keep in mind when we talk about these tax credits moving forward. Then in 1986, something happened profoundly affecting the cost of health care, and that was when EMTALA passed. And EMTALA is the Emergency Medical Treatment and Labor Act. What was happening, and it was not happening in places like Steamboat, it was happening in large urban areas. Hospitals, with emergency rooms, somebody would come into the emergency room and present themselves, and if they didn't have that insurance card, didn't have insurance, and they were not in a critical condition, literally would happen, they'd call a taxi and ship them to county hospital, so the hospital, did not have to absorb that uncompensated care. So Congress decided that was not good, so they got rid of that with EMTALA. However, since its enactment in 1986, it was never funded. So as Aaron referred to, what happened is this uncompensated care cost shifting started. So the people that went into the ER and couldn't pay their bill, the hospital can only write off so much, the physician can only write off so much. The rest of it had to be cost shifted to, in a couple of cases, the next person who came into the ER, bandages went from costing $1 to $5 to like $25 now that we see. Or to the people who had health insurance. Health insurance premiums started rising because even though the patient couldn't pay for it, those costs didn't go away. So somebody has to pick that up. And so health insurance premiums started going up, and certainly costs. One of the other reasons I got involved in this is I have no background in health insurance or insurance. Nobody in my family is a medical care provider, but I'm a consumer. Our daughter was born in 1976 in Fort Collins, Colorado, $600 total, $600, $300 for my prenatal care, $300 for an uncomplicated overnight stay at Poudre Valley Memorial Hospital. My daughter my lifetime. We know what's happened since then, and and you can see the trends. We are not going in the right direction. And so she fell exactly in this bar chart, and in 2010, the average per person health expenses in our country are $8,402, not sustainable for families. And not sustainable at the government level either. And in fact, according to Bob Simrow of the Bell Policy Institute, 18 cents of every dollar that gets spent in our country goes towards healthcare costs. To put that in perspective, a dozen eggs would now cost $55. A gallon of milk would be $40, and a dozen oranges would be $134. So this is just to give you a perspective about why we are working so hard and why Bill and Aaron are so busy, is because what we were doing was not working. And it was completely unsustainable to a family, to an individual, certainly to small businesses, and without a doubt to our government programs as well. So this isn't new. We've all been sort of watching this. We've heard about it. We've heard about it for years. We've heard about it for decades. But Colorado decided to do something about it. We've been in the leadership role in this, I think, for quite some time. And in 2006, Governor Owens decided to take it on. He was looking at how much of the state's budget was getting chomped up to healthcare costs. And because state budgets, unlike the federal budget, has to be balanced. So they can't just print more Colorado dollars. They don't exist. So they have to present a balanced budget. And with so much of the money going to these increased healthcare costs, that was affecting higher ed, K-12, highways, prisons, those sorts of things that state governments are responsible for. So Governor Owens arm twisted, or I don't know how he did it, 27 people from across our state. And he asked them, they were people, Steve Birkenbrack, the CEO of Rocky, Mike Promenko's a primary care physician, I think Sue Birch maybe, I don't know. Lots of people were involved in that, of the 27 people, Democrats and Republicans. He made sure it was, half and half, and asked them, would you be willing to look system-wide at these costs and determine if there's anything we can do as a state to try to capture these costs and start bringing them down, or we're not going to be able to drive on paved roads. And these 27 people agreed to do that. They started their work in 2006. They worked all the way through 2006, they worked all the way into 2007, and in January of 2008, they presented their report. 24 of the 27 commissioners signed off on it. And the important thing is this report is available online. You can Google the 208 Commission or the Blue Ribbon Commission on Healthcare Reform. You can see the whole thing. But there also is an executive summary that is really good to read. It kind of brings the whole thing in. But what they said on the inside, and I think this is really important to all of us who really want to solve problems, is the unprecedented nature of their accomplishment, the fact that such a diverse group representing such a broad array of backgrounds, ideologies, and interests was able to come to agreement on these recommendations, signals that real reform was indeed achievable. Now, I've talked to people around the state who were on that commission. And I said, what was it like? How did you do that? How did you come up with these solutions? And they said it was horrible at the beginning. There were people on this side that said universal single-payer health care. Until we do that, we're never going to bring these costs down. There were people on this side that said, forget it. The government should not be involved. We need private solutions. We need market-driven solutions. That's the only way we're going to bring prices down, is when competition comes in. So they started at very opposite ends, and there were some people that thought, this is never going to work. I'm going to quit. I'm just not going to stick with it. But they did. They did stick with it, and they did come up with a conclusion, and they published it. And what they came up with, among other things, is that coverage is key. We have got to reduce the number of uninsured. By extending insurance coverage to more Coloradans, they aim to minimize the hidden tax of this uncompensated care, stabilize rising costs, and improve Coloradans' health. This document lays out a roadmap for healthcare reform, and it was published in January 2008. Their key recommendations include: individuals have a responsibility for their own health and wellness. I mean, this makes so much sense, but to me, this is one of the big disconnects to this whole conversation, is if you're lucky enough to have this health insurance card, then I have insurance. Oh, so it's December. I've met my deductible. What do I need to get done? And so just because you have this card, we need to be good consumers. Somebody's paying that bill. And if you have a $20 copay, or if you've met your deductible and you get a procedure that you don't need, or something like that, understand that there is a real consequence to that cost. It doesn't just go away. Government, employers, and insurers should promote and encourage healthy lifestyles and preventative care. And I think we've seen a lot more of that in the last several years. We've seen smoking cessation programs. We've seen wellness fairs. And so we're moving in that direction. But this third bullet, I think, is particularly interesting. Require all legal residents of Colorado to have minimum insurance coverage or an individual mandate. Do this by expanding eligibility in public programs, providing sliding scale subsidies based on income, and require health plans to cover everyone, because on the individual market, and many of you probably know this, is if you had a pre-existing condition or you got sick, the insurance company could just say no. You couldn't write a check big enough. My husband was denied health insurance because he has arthritis in his wrist. Nothing else wrong with him. But because I happened to work for a large employer at the time, when the open enrollment came around, could bring in the same guy who had the same arthritis, but all of a sudden he's covered. So anyway, that goes away. And then finally, the fourth bullet, enforce this through the income tax system. Now, what does that sound like? But this was January, published and presented in January of 2008, which was 10 months before the presidential election that year, and 2.5 years before the Affordable Care Act passed in Washington, D.C. So that's why, no matter how we want to look at this or what side of the aisle we might sit on, this is Colorado's solution. This is a bipartisan solution. Nobody really likes to be told what to do, but this is what 27 people who really care about Colorado and know what they're talking about, this is what they came up with. So the other interesting thing is, fast forward 2.5 years and we know exactly what happened at the federal level. The same thing that happened at the Colorado level. People on this side said universal single payer health care. People on this side said no way, we want a private market-driven solution. So at the end of that, the Affordable Care Act passes and it's 2,000 pages, and among those 2,000 pages, there is a provision that says each state can design their own exchange or marketplace. But you can't opt out. So you states, all these people wanted states' rights. If you states want to do this, you can design your own. But if you don't, you will get a federal exchange because you can't just opt out. So Colorado, along with these other green states, decided to take on the very, very, very hard work of building this technology infrastructure, and we have our own marketplace. It is called Connect for Health Colorado. The purple states are doing some kind of a mixture, and the white states are not doing anything on their own. They're relying 100% on the federal marketplace. Those white states are the ones that are impacted by healthcare.gov. Those white states are the ones that have had the really tough time. Now, I've shown this map well before October 1 when everything went live. But even then, throughout the summer, I said, take a look at this map and be such good listeners as this thing rolls out in October and now November and now we're in December. Because this is going to be a rocky road. I often use the analogy Back to the Future, and Marty McFly and the professor building that car, what was it, a DeLorean? And it's got to launch across the courthouse at 2 o'clock and lightning strikes. It's a bumpy thing. This is a big, big deal. And Colorado is working hard. I know the people that are on it. And we expect some bumps, but I cannot imagine what's going to happen at the federal level. And sorry to say I was true, but I wish the feds well, and I think they're getting it figured out. Clearly, they're getting it figured out. But the important thing is we're not the feds, but we're also not California, and we're also not Vermont. Because of these green states, each one of us did it differently. Each one of us got to design our own marketplace. Vermont is going towards a single-payer system. California's system is market-driven. They are telling insurance companies what you will do. We are completely market-driven. If an insurance company carrier wants to put a plan in our marketplace, as long as they meet the Division of Insurance's criteria, we're happy to have them come and sell their products. So we are completely market-driven. But the interesting thing is going to be, now that we are open for business, as is all these others, we're going to be able to know, it's like an MBA case study, we're going to be able to know which model works, which model captures the most uninsured, which model brings down healthcare costs, because We now know, we're live. So that's why we are doing this. I think it's important to keep that. We had to do something, and I think Colorado has a really good plan in place. I think there are opportunities for improvement and revisions. I think Aaron and Bill did a good job of outlining what those are. We are nonprofit. Both Aaron and Bill talked about the fact that you can compare plans side by side, and Connect for Health Colorado, and it's worth repeating, is the only place if you purchase health insurance and you qualify for a tax credit through the individual market or the small business market that you can get the tax credit. So that's a very important thing to keep in mind. But I think it's also important to know what we are not. We are not a replacement for the current market or for brokers. As Bill said, we're thrilled that we have 150 plans in our marketplace for Coloradans to shop for, but there are going to be plans outside of our marketplace. The 150 plans that we have inside our marketplace cost exactly the same as they do outside, no difference. And as I think Bill said, the access to brokers, access to health coverage guides, access to our call center costs the consumer nothing. Our sustainability plan, because we have funding from the Affordable Care Act, goes away at the end of this next year. We have to be self-sustaining. That's how we were created. And our sustainability plan is a 1.4% assessment on each policy sold. So that's our business model, generally speaking. And so it doesn't cost you any more. We get paid by the carriers. We are not a part of Medicaid. We are not a part of Medicare. Connect for Health Colorado is for hardworking Coloradans that make more money than Medicaid. They're not 65, and they don't work for a big guy. Basically, that's who we are for. We are not a state agency. We are not part of the state government or a regulatory body. And we receive no money from the Colorado General Fund. You no longer can be denied health coverage because of a pre-existing condition. They don't even ask those questions, and you can't be dropped if you do get sick. Insurance companies have to demonstrate either an 80-20 or an 85-15 percent of their money that they bring in on premiums has to go to health care costs. That is put in as sort of a check and balance so that administrative costs and other costs outside of taking care of Coloradans' health, if they spend less than that, then they have to refund the money to their taxpayer or to their premium policyholders. Comprehensive coverage, Aaron had that slide in there. And likely to shop with us, as I said, people who currently buy insurance on their own, who are uninsured or self-employed, and don't have access to employer health care. But without a doubt, and I mean, I say this over and over again, working with your brokers and your health coverage guides, and particularly as Aaron and I were talking after Bill spoke, brokers are the experts in this. Health insurance is complicated. It's significantly more complicated than buying an airline ticket. You've heard that comparison. We're like Travelocity. Well, a little bit. You compare the policies side by side, but it's very important that you seek out the help you need to purchase this health insurance. Open enrollment, as you know, we're right smack dab in the middle of it. People right now have until December 23rd to purchase a plan that will be effective on January 1st. The tax credits, once again, in case you missed them when Aaron was talking. And the tax credits, as Aaron said, you get them in advance. So that's the difference. Any of you that got a tax credit for putting insulation in your attic or geothermal or anything like that, you made the investment up front, you filed your taxes the following April, and you got your credit. This tax credit is different. You get it every month. So if your premium costs $500 a month and your tax credit is $300 a month, you will write a $200 a month check to Rocky Mountain if you choose them, and the IRS sends the other to Rocky Mountain. So you don't have to make up that whole amount and then file your taxes next April and get that back. It's an advanced premium tax credit. So that's an important thing to know. And the other thing to keep in mind is when you purchase your plan through us, we're the facilitator, your card will say Anthem or Rocky Mountain Health Plans or Kaiser or whoever you pick. You won't get a Connect for Health plan card. Your relationship is directly with your carrier. We're simply facilitating. That's what we do. Now, if you don't qualify for a tax credit, if you saw those income ranges, if you're outside, I would suggest that we're still a good place for you to shop, especially if you are in the individual market, because once again, you're not going to have to go to Rocky, Kaiser, Anthem, and fill out their lengthy application each time, although it's a lot less lengthy. You'll fill it out. You'll fill out one application, and all those insurance carriers will have that, and you'll be able to compare side by side those plans. And the important thing is, sitting in this room right now, as Aaron did a good job of telling you, these tax credits are based on your projected income next year in 2014. And so you're outside of that. Well, and I'm glad you're outside of that. But if something happens and you drop down into those ranges, if you did not buy a plan in Connect for Health Colorado, even though you might qualify mid-year, you can't get it. That's just the way the law is written. So that's why I would suggest it's a good place to shop for your health insurance, because you never know what 2014 might bring. How much will I pay? This is something I learned that I didn't know, and probably, unless Bill probably knew all about this. For over 25 years, rates in our state have been divvied up based on geographical regions. I didn't know that. I thought you live in Colorado, this is what you pay. No, it's not the way it works. There are 11 rating regions in Colorado, and the rates are significantly different. You can go to our website, we have a calculator. You can put in a zip code and you can see the differences. For instance, I live in Montrose and I'm in the region 10, the same as you guys. But people in region 11, which is the resort areas of Aspen Vale, trying to think, those places, they pay the highest in the state. And this is, I'm not kidding, the rates for the same plan can be $700 a month in Glenwood Springs, Colorado, and $250 a month in Denver. Same plan. There is a significant difference, and when you hear that, it's like unbelievable. Now, what I can tell you is the tax credits, if you fall within those income tax ranges, to get a tax credit, even it out, so that the net for people that live in those resort areas will be similar, in some cases lower. But if you're outside of that, you're outside of that, and that's the rate you pay. But the thing to take away is this is not ACA. That's been going on for 25 years. But this is, to me, one of the, this is difficult, this is hard stuff to learn, but the silver lining of this is that we are all sitting in this room learning about it now. And we are finding out what it's going to be like to be a good consumer of healthcare, because these costs are real and they've been in place for a while. These healthcare costs have not just gone up this year, have they, Bill? Have they been going up? Well, you saw the chart. Remember the chart I showed you? I mean, they've been going up well before the ACA even passed. Here are some of the ranges right here in Routt County. 40-year-old with a bronze plan. So competition does work. I mean, it's beginning to work. With a low of 278 up to a high of 470. So key takeaways, because I know you're all busy and getting ready to go back to work. Connect for Health is not part of the federal marketplace. We are not part of them, never have been. We have a broad array of choices. We are the only place that you can access a tax credit if you qualify for it. You can get help over the phone or in person with your local brokers, and it costs you no additional money. Customers who enroll by the 23rd of December this year will have coverage that begins on January 1st, and open enrollment continues through March 31st. How are we doing? How are we doing? We're doing okay. We're not doing as well as we hoped we would be. But we're doing pretty well. And you know, I'm not going to put this all on the feds, but I think clearly the media coverage that came out because of their, really below average rollout has impacted the number of people that didn't realize that Connect for Health Colorado is different. But we have now 9,980 people covered lives, and as of yesterday, because I called, we're up to 15,000. I mean, the numbers, over 1,000 every day. People are coming in, they're getting the help they need, thanks to our coverage guides and our brokers. We've got you know, it's just amazing what's happening. These are two bar charts. I pulled this off of NPR's website this morning. The one on the left shows residents who selected a plan by state. You can see Colorado is in 1, 2, 3, 4, 5, 6, 7. We're like 8th or 9th in the country. The chart on the right is the percentage of uninsured, because remember, this whole thing, one of the big movers of this is to get people that are uninsured covered so that the rest of us that pay for medical care and pay for health insurance, that those costs will start to come down. And you can see where Colorado is there. So I want you to leave knowing that we're doing this because what we had been doing was not working. We're doing this as Colorado because we had a Colorado plan in place, and I think we're finding some success, and I just want you to know that, because this is hard stuff. And it's complicated, and I'm glad you have such resources here locally. So thank you for having me. Thank you for Lunch Wells Fargo and Yampa Valley Medical Clinic, and that's it. Thank you.